an annual census of homeless people in Dallas and Collin counties that helps the city determine how its homeless programs are working will still take place during the COVID-19 pandemic, although at a later date, over a longer time period, and with far fewer people doing the counting. You're listening to the CobCast. I'm Cobb, and this is The Cast. The U.S. Department of Housing and Urban Development, or HUD, requires communities that receive certain federal grants intended to combat homelessness to count sheltered homeless individuals annually. Unsheltered counts are required every other year, but many counties, including Dallas and Collin, do both annually. I spoke with a guy who knows a thing or two about these counts. His name is David Gruber.
And I am the Senior Development and Communications Director for the Metro Dallas Homeless Alliance.
That's the lead agency for the homeless response systems in Dallas and Collin counties. The alliance is in charge of coordinating, among other things, these annual counts. Gruber explains the importance of them like this.
Imagine you're flying an airplane, right? You've got the windows outside the cockpit. You're able to get a lot of data just from, you might not think about it that way, right? You're just looking, right? You get a lot of data that way. And then you have your instruments that pick up data, and that way you know where to fly, where not to fly. If suddenly you did not have any data, you wouldn't be able to fly the plane. For that matter, you could hit the side of a mountain and not know it. Whenever you're trying to deal with any situation, with any challenge, with any problem, you have to have good data. So if we are trying to end homelessness in Dallas and Collin counties, in Texas, and the entire United States, we have to have data about it.
This annual count allows the agency to track different aspects, like how many women are homeless, how many men are homeless, and what's working and what's not working to reduce homelessness.
We collect data throughout the year. However, there is a lot of importance to conducting a what we call a point-in-time count, right? Point in time, because it's a point in time, it's a snapshot. And doing that every year, more or less at the same time, where we not only count folks in our shelters, but we also go out into the streets and literally survey all of the, let's say, all the parts of Dallas and Collin County where people actually could stay, right? You're not looking to go in the middle of a lake or something, right? Basically go into every census tract, check if there are homeless folks there, and if you run into homeless folks, to either interview them.
In which case they might ask questions like,
how long have you been homeless? Are you a veteran?
And
where did you live before becoming homeless?
I would love to find another job. You know, I love to cook. I am a professional cook. I've cooked for 2 governors of the state of Louisiana, entertainers, and I love cooking. I'm 59 now. I can't work anymore. I'm not supposed to, but I will. You know, what God said.
Or if they're not willing to be interviewed, to at least record an observation about them.
last year, the count found that after years of increases, Dallas saw fewer people experiencing homelessness. It also found the city's efforts were successful in moving those people from one place to another, but not getting them off the streets and into housing. The pandemic, though, will poke some holes in the dataset. told me a little bit about, the importance of it and how it generally happens, this count. Tell me what's going to be different this year, and kind of, if you could touch on, some of the struggles that you guys might face because of these differences, and maybe, if there's anything, how this might impact the people that you guys are counting.
So basically, there are three differences, and I'll tell you the differences, and then I'll kind of go through what It'll almost be self-explanatory.
Right.
So COVID is the answer, right? But I'll kind of flesh it out for you. So three big differences. So the first difference is we're only going to use street outreach professionals to perform the actual count. So usually what happens is we get about 1,750 volunteers all across Dallas and Collin counties. We gather them at a few different sites, right? We register them, we train them, we send them out into the night, right, to do the counting. Now, that obviously is a non-starter, right? I mean, you can't gather hundreds of people in the same place. Also, you can't really have 1,750 people, even if you could somehow do the registration and the training, virtually. You can't have teams of people, right, that are going out in cars and going and interacting with a medically fragile population. Research shows us that homeless folks are 3 to 4 times more susceptible to contracting COVID-19. So we can't send teams of volunteers out there to interact with this medically fragile population, and then go back to their families, right? That's just a recipe for a disaster, right? So that's why we're using only street outreach teams. These street outreach teams, this is what they do for a living. They're constantly interacting with these folks. They are well trained in how to interact with them during COVID-19. They wear PPE, they do the social distancing, and drilled into their head how to do this work. So that's number one. Now, because we're using about 100 street outreach volunteers instead of 1,750 people, what flows from that is the next difference. And that is that rather than doing it over the course of one night, we're doing it over the course of 14 days. It always refers back to the specific night, right? The question we're asking always is, where did you sleep the night of February 18th? However, just because 100 people can't do the work of 1,750 people in one night, it's being spread out over 14 days. Okay? So that's the second difference. The third difference is that we want to make sure that not only do we have proper social distancing, not only are they wearing proper PPE, but that interactions with the homeless folks are kept extremely brief, right? And so rather than asking them a long list of questions, so usually we have our volunteers ask a long list of questions so we can gather as much data as we can, right? More data, right? Better understanding of the problem. We're having them go through a very brief survey. We're going to collect about 8 or 9 pieces of data, items of data. And so those are to keep the interactions brief. So those are the three big differences. What is really underlying this is that we know that we're not going, because of all of this, we're not going to be able to get as much data as we got in the past. And though we're going to try our best, this probably will not allow for apples-to-apples comparison. So, beginning of our conversation, I was like, well, you can track things from like 2017 to 18 to 19 to 20. We're doing these comparisons, year to year. We're not going to be able to do that. And HUD has basically said, we don't expect you to do that. There are, in fact, communities in the United States that are not even going to do account because of COVID-19. So many communities in California, because community spread is so high, they're just like, listen, there is no way we can do this safely, period, we're not doing it. But HUD said, if you can do it, that's great. Do it. And what we really just want to see is we want to answer one question this time. And that is, has homelessness gone up or gone down or stayed the same in the era of COVID-19? So it's very different, not only in the way we're conducting it, but also in what we hope to get from it.
In early January, a spokesperson for HUD told me that 150 continuums of care, nearly 40%, have requested some kind of an exemption from the point-in-time count for unsheltered homeless individuals. Continuums of care are the regional bodies like Metro Dallas Homeless Alliance that coordinate these annual counts. HUD anticipated more would request exemptions or waivers. The department is also allowing municipalities to use sampling instead of conducting a complete count. While this takes less time and reduces the risk of contracting the virus, sampling relies on assumptions about where the homeless people are and isn't as accurate as a full count. According to Bloomberg, these counts are understood to be off by as much as half or more, even in normal circumstances. Is this going to affect, the way that you guys implement changes to try to reduce homelessness?
I think it's going. Even in the normal year, even without COVID-19, a community that only relies on that once-a-year homeless count is not going to, do that well. It is just a once-a-year snapshot, So and again, I would analogize it to your airplane, right? So, and neither of us are pilots, right? But you're looking out of the windshield, but you've also got all these different types of instruments that are giving you lots of data. And so this is just one of those instruments, right? So throughout the year, we're using other various tools, to measure what's going on in the community. Like everything in COVID-19, right? In every area of life, we're hobbled, right? But it's not like we're flying blind.
And this might be, a well-duh question, but what is your impression? What do you think you all will find? There's a lot of talk about, evictions this year as the result of all the job loss and everything. Do you think that you'll find that there's been an increase, in fact?
So this is actually not so much of a duh question. It's actually more complex than you would think, so I'm glad you asked. You're right, there is that additional kind of unknown input of not just evictions that happen, but what are future evictions going to look like? On the other hand, the CARES Act and the last stimulus has brought a lot more money into the system, right? So they knew there was a huge increase in need, and so a lot more money came into the system, and so we've been able to do things we haven't been able to do before. I don't know if you've noticed, you may have noticed the city of Dallas has already bought like three old hotels, and they're turning them into housing, and word on the grapevine, word on the street is that they're looking to buy a few more. And they house, I'm going to say, the city of Dallas went on like a rapid rehousing spree at the end of last year, and they housed like 300 individuals and families. We're getting additional funding where we're going to house about 700 additional individuals and families. So it's kind of like, yes, you do have the inputs are increasing. Hopefully the output, right, of getting folks into housing increases beyond that, and then despite there being a pandemic, we can see a drop in homelessness rather than a rise in homelessness, and at the very, very least, kind of hold the line.
The count got underway last week as the whole state of Texas froze from winter storms. Gerber said he hopes the cold weather drove most of the city's homeless into shelters, where they will be easier to count. I'm Jacob Vaughn, a journalist based out of North Texas. Some people call me Cobb, and this is the CobCast. Thanks for listening.